It's great to welcome back Jenn Coffey. Good morning, Jen.
Good morning.
Excellent. So taking attendance. And also we have, Dr. Steve Auerbach. Thanks so much for joining us.
Great to be here, Bob.
So CNN is reporting that United Healthcare, one of America's biggest companies, is imploding with its stock losing half its value, a staggering $288 billion in the span of just a month. Now CEO Andrew Whitty stepped down abruptly for personal reasons. United Health also swiftly abandoned its financial guidance, blaming skyrocketing medical costs. It's also relevant to mention as Whitty earned over $26 million in 2024. Meanwhile, the Wall Street Journal reporting this week, United Healthcare is under federal criminal investigation for possible Medicare fraud. So what's your reaction, Jen? I know you did a great imitation of Sir Whitty. I will never forget when you did that Diane at Wall Street. I know. So what's your take on this?
Well, I'm hoping that this change with them will actually do something valuable for patients, but I'm worried because so far all Hennelly has done is talk to stakeholders, talk to employees, talk to shareholders, but I've yet to hear him say anything to us, the members, and the people who are suffering because this company denies and delays care all the time.
Yeah, this is we're recognizing that they're not alone in this kind of an issue. Evidently, United Healthcare is not the only one that's coming under scrutiny. The Department of Justice announced a false claims case against Aetna, Anthem, and Humana, alleging that the healthcare brokers allegedly directed Medicare beneficiaries to the plans offered by insurers that paid brokers the most kickbacks. And we ironically saw that in the Aetna plan with the city of New York, that there were quote-unquote gain-sharing provisions in our own contract. According to the complaint, the brokers incentivized their agents to sell plans based on the kickbacks, setting up teams of insurance agents who could sell only those plans and at times refused to sell MA plans of insurers who did not pay sufficient kickbacks. And I think I did a video on this where we showed that there were a bunch of agents on a screen on a Zoom call training others and giving them tips on how to maximize their kickbacks up to 3 times what they should have been paid. What's your reaction to that, Dr. Steve?
Well, business as usual, and what's new? This is what the insurance companies have been doing for years. I guess I'm a little bit more cynical that anything good for patients and persons living in America will change with all of this. I mean, what we are seeing is how for-profit corporate health insurance is a way of financing our healthcare system is an inherently self-conflicted, broken model. One of the things that happened was after the murder of the CEO and after there was greater attention to
Brian Thompson, right.
So after that, there was greater attention being paid to the harms to patients, and so they offered some vague reassurances to patients, they being the insurance companies like United. And then, of course, what happened was the moment they said, oh, no, we're going to do better by our patients, then the stockholders got frightened that their profits weren't going to meet quarter-on-quarter bumps. And so they got pummeled and sued by the stockholders. The fraud cases, this goes back years. You can just track, year after year after year, there are these cases that come up at the state and federal level. They get paid as a cost of doing business. Meanwhile, United still employs 10% of American physicians. They still talk out of both sides of the mouths when it comes to pharmacy managers. And pharmacy benefit managers, because of course they own the pharmacy benefit managers, so they condemn their, out of one mouth they say, oh, PBMs are the problem, and then out of the other mouth, it's just another piece of their balance sheet, playing games with one side of the balance sheet to the other. I'm dubious. There is some alleged bipartisan Medicare Advantage heavy on the quote-unquote reform by both Republicans and Democrats in Congress. But the conservative movement is absolutely committed to continuing to privatize all public goods, including Medicare. So I'm doubtful in the long run, or even in the 12-month run, that anything good's going to happen.
Right, and so, Jenn, as you mentioned, it's I guess the successor to Sir Whitty is CEO Stephen Helmsley. He doesn't seem to have a Sir in front of his name. He'll get an annual base salary of $1 million and a one-time $60 million equity award. That's according to Reuters. Jenn, you also, one of the things we have seen is finally some real detail about what is in store for Medicaid folks with this GOP House bill. And so we're now looking in that, before it was $880 billion cut. Now, as Catherine Carley informed us, it's like $600 billion. And we're hearing all kinds of things on Fox about, well, now it's time for those Medicaid people to start working. And when you drill down, there's a reality that so many millions of Medicaid recipients, particularly through ACA, the Affordable Care Act, are working, and then folks are also disabled. Can you talk about this potential implosion of the Affordable Care Act by this gutting of Medicaid? There's a connection there, isn't there?
To put it frankly, people are going to die. People are going to die. We are taking away the very tools that they're holding on to life with. You're talking about Medicare. What is it? 1 in 4 kids are on Medicaid, right? You look at people in nursing homes. What are we going to do with our elderly? Are we going to throw them out of nursing homes because the bills don't get paid? Medicaid is a lifeline for so many segments of our society. And the people that can have Medicaid are making pittance. They're making pennies. They can't even afford to pay their rent. They're balancing groceries with medications. And now you want them to pay a premium on that? What are they going to pay it with? Are they going to take out the milk and the bread? Are they going to ask the landlord for an extension on their rent?
Not the eggs. Certainly not the eggs. They could go down to their bodega now and buy. We're selling eggs as Lucy's, like cigarettes, like 3 in a bowl. 1 if you're really good.
Yeah. So the plan is to kick millions and millions of people off of Medicaid. And as Jenn was saying, Medicaid actually covers persons at all ages. You know, it covers 25% of births, antenatal care, children, and adults and the elderly, in both home care and long-term care. But it's being done in multiply devious, clever ways in that, for example, one of the things that's going through as the alleged compromise, quote unquote, and the connection to the ACA is to cut the federal payments, co-share that the feds pay to states for Medicaid. So what this is in effect doing is it's washing the federal government hands of it in order to do the tax cuts for the wealthy. We need to remember all of this. It's not just the goal of cutting Medicaid. It's the goal of taking the money that should be going to Medicaid, that should be going to researching cancer, that should be going to protections for consumers, and giving it to tax cuts for billionaires. But with the shift from the federal share, what this means is they're shifting the burden and decision-making to the states. And this has the additional political goal of, let's say, a blue state like here in New York, or a relatively blue state like here in New York, to have to make the decision at the state level: are we going to use state funds to cover the difference, or are we going to do a race to the bottom and copy Florida and Texas and do less? And so it not only is harming patients, but it's a deliberate attack, frankly, from the Republicans onto state level Democrats and blue states on whether or not they're going to raise their taxes, and we should be taxing the wealthy more, or cutting benefits and having a race to the bottom. So it has multiple nefarious reasons for happening this way.
New York City retirees.
If I can jump in.
Bob and I have spoken about this before, that we have a lot of dual eligible retirees that are both on Medicare and Medicaid. And you're absolutely correct, Dr. Auerbach, in that many of our seniors do rely on the Medicaid aspect in taking care, providing that home care or nursing care to them that they don't get from straight Medicare. So Medicaid fills a lot of those gaps for people, and they're low income enough that that's what they have. To take that away from them puts their lives at risk and creates a grave burden to their families. As Jenn did say before, we also learned about people making those choices, those very difficult choices, when those costs get so high that they're literally chopping their pills in half instead of taking the full dosages of their medications, or not taking their medications because they need the money for a utility or for food. And this is not how we should be treating our American population. For one of the wealthiest countries in the world, our healthcare is absolutely abominable that we don't value the human life the way other countries do. We don't really care what happens. And the trickle-down effect is also going to be on the hospitals, because doctors do have a duty to treat the people that do come in there, whether they get paid or not. When people get sick or hurt or living on the street because they're homeless and need health care, they're going to the hospital. So that will destroy everything all the way down.
So, Jenn, you were going to say?
Couple points to piggyback off of what Steve was saying. Here in New Hampshire, to give an example, and this is going to happen in different states around the country, we have like a trigger law, if you will. So if the federal government is going to come back on the Medicaid dollars, the state has a law that says, well, if they're cutting, then we aren't going to pick up the slack. We're going to go back to pre-levels before we had, right? So this is even worse. So not only is the federal government doing that, but a number of states have automatic laws that are going to just cut them off right at that. What I was going to say about what Marianne was saying is she's 100% correct. I have CRPS, complex regional pain syndrome. And if your listeners may or may not know, it's the most painful disease known to medicine. And people in my community, including myself, are preparing for rationing. We're preparing, because as a United Healthcare member, I've received a number of letters so far this year. They've been very aggressive as far as I'm concerned. They've announced they've told me they're not going to cover my treatments anymore. They sent me a form and told me to apply for reimbursement. Maybe they'll give me some money back. They denied another medication. I'm very concerned that I feel like they're being aggressive. And when you add to that the fact that the shareholders have filed a lawsuit, and in their lawsuit, and I'm taking this from CNBC, they said, quote, that they were upset because the aggressive anti-consumer tactics that it would have been needed to achieve their goals weren't done. They're mad that their goals didn't get hit. They didn't make enough money. They don't care how many people died in the process.
Dr. Steve,
exactly.
Actually, and call us if you have concerns or an experience. We want to hear from you. 212-209-2877. 212-209-2877. So, Dr. Steve, coming full circle, the other thing we're seeing that in Pennsylvania, we do see where private venture capital had a couple of hospitals, I believe. That venture capital collapsed. The hospitals closed. So this is another thing going, as we do in the show, down to the granular level, the state level. Gretchen Morgenstern's great book, I'd love to have her on, called The Plunderers, right? A long time ago, really laid out in a map for us how venture capital, and hedge funds had gotten into congregate care facilities, had gotten even into ER rooms, buying up practices. Could you bring that piece to the table to help us understand?
So we've had a series going way back to 1973 when for-profit medicine basically took off the United States. We've had a series of going from publicly traded stock companies like Hospital Corporation of America to then venture capital coming in, and then private equity. And it makes a difference in terms of just how evil each one is and how likely they are to go belly up under different circumstances. So as interest rates rose, a lot of the private equity gaming began to flounder. Now they still extract profits for the investors, mind you, but when the hospitals go belly up, this then leaves communities without care. But don't worry, the people who put the money in early on definitely still made a profit. So we don't need to worry too much about them. That was a bit on the heavy sarcasm. But what we are seeing, is, as you said, these hospitals are going belly up in various areas, and the communities are then left without care, and the states are often left having to bail them out. So once again, it is, if you will, capitalism for the already rich, socialism for the already rich, and aggressive capitalism for the rest of us. And I just want to, piggyback on something I was alluded to before, which is that it doesn't have to be this way. A lot of the articles we see criticize what's going on, but they don't point out, there's sort of a blanket refusal to acknowledge that it doesn't have to be this way. Every other rich capitalist democracy around the world does it differently, and we could too. We have the New York Health Act here in New York, which, I personally believe that state-based is the way to go because blue states will lead the way with proof of concept. We also have at the national level reintroduced the Medicare for All Act from Sanders, Dingell, and Jayapal. And if I may, I'd like to also point out that we have a rally coming up on May 31st, Saturday, May 31st, 11 a.m., for those of you in the greater New York City area, at the Social Security Office building at 237 West 48th. That's 48th between Broadway and 8th Avenue. Save Medicare, save Medicaid, save Social Security. This is part of a nationwide series of actions. And again, it does not have to be this way. This is not lefty pie in the sky. Every other rich capitalist democracy in the world does it better. And we in America can do so too.
I wanted to take advantage of the fact that you are an expert on the big picture and talk a bit about what we're getting for our money and the way that American life expectancy, it's really a scandal. When you look at where we were at in the 40s and 50s and then the retreat, give us a sense of a top line in the sense that it's the most expensive healthcare system in the world with the poorest outcomes when you consider our ranking as supposedly a wealthy democracy. Give us the stats, Doctor.
So there's a classic bang for the buck curve, if you will, where the comparison is made on how much we spend GDP per capita versus, and I wish we were on television or video here. But going back to the 1970s, the United States was always at the bottom when you compare us to the other OECD countries, the other rich capitalist democracies around the world. But we were at least touching, if you will, where the others were. Especially since 1973, first with the HMO Act and then other neoliberal privatization of public goods with Medicare Part C, relabeled Medicare Disadvantage, and then some of the negative effects of the ACA. Since 1973, we've seen an accelerating divergence where the United States used to be touching, at least, on the bang for the buck curve, all these other countries, and we are acceleratingly doing worse. So we used to be maybe 2 years less life expectancy and paying only 10% more, and now we're over 5 years discrepancy and paying 50% more.
Outstanding. And
we also have recent analyses. These are in the peer review journals that across all countries, the wealthiest are, of course, living longer and have greater life expectancy and have greater added life expectancy. So once they've even reached adulthood, but the United States is the worst of those countries.
Excuse me, Dr. Steve, are you suggesting that the wealthy should not live much longer than the poor?
I believe, as I believe it was Mel Brooks who once said, it's good to be the king. And it's bad to be the rest of us. So we've got both the fact that we have this huge increasing wealth and income inequality, and when it comes to the health impact, that too is growing. And we need to do better. We need to improve the income for the other 95% of Americans. And we need to have comprehensive coverage for everybody living in America, regardless of changes in life circumstances. May I point out that United Health, even though they're being hammered by Wall Street this quarter, is still making huge profits? What they're being hammered on is expectations. What they're being hammered on is quarter-on-quarter reports. This is no way to finance healthcare.
Yeah, so I guess, Jen, I'm so glad you joined us. Is there anything we can put on the radar that you're doing? I know you're active in so many things, both in New Hampshire and around the country. What's on your agenda for the week ahead?
I know there's lots going on, but the most important thing I want to put out there is if you're struggling, if you're fighting the insurance company for the healthcare that you need, please go to careovercost.org. There is help at careovercost.org. You can tell your story. You can get people to help you file appeals. If you don't know how to do that, they'll help you. They'll walk you through it. You don't have to fight the insurance company alone.
Okay, that's great. We want to have you on and highlight that. Maybe do a whole hour around that on our national program. We Decide, America at the Crossroads, with Jenna Flanagan. It comes on after Democracy Now! Okay, you game for that?
Absolutely.
All right, thanks so much. Dr. Auerbach, you want to repeat the coordinates of the rally and anything else you want to say in a minute?
Yes. So first of all, I would hope folks in both nationally and in the New York City area especially will join up for Physicians for National Health Program, pnhp.org nationally, pnhpnymetro.org here in New York. And we have the upcoming rally on May 31st. That's a Saturday, 11 a.m. In Manhattan at the Midtown Social Security Office. That's 237 West 48th Street. May 31st, 11 a.m. Save Medicare, save Medicaid, save Social Security.
All right, thank you so much. That's Jenn Coffey, former EMT, New Hampshire member of the New Hampshire legislature, national activist for healthcare that we can all live with, and of course, Dr. Steve Auerbach, who is a veteran in the U.S. Health Service and a leading advocate for single payer, particularly New York Health Act. We'll be back on the other side.